Hi friends, good evening. I'm Hema, a nursing officer. I have a nursing experience about 16 years. Um, I'm working as a registered nurse in ICU. Okay, today I'm really happy to share the knowledge and also I welcome you to my channel. Okay, okay, friends, I'm going to talk about vital signs, which is a very important topic and fundamental of nursing and also in our practice. Okay, we must know the content for our nursing practice or for the exam also. It's very important. Okay, now I'm going to talk about the vital signs. Why we are going to check vital signs? What is the parameters of the vital signs and why we are when we have to check the vital signs. Okay, so first we are going to see the definition. Okay, vital signs are objective measurement for the essential physiological functions of a client. Now if a physiological functions are normal, the vital signs also normal. Some of the parameters that we are going to measure to know the basic or essential physiological function of the client. Okay, some of the data we are going to measure to know the real physiological kind of functions of a client. Okay, so then only we came to know the health status is normal. And the next is the first set of clinical examination is an evaluation of vital signs of a client. You may observe whenever we are doing clinical examination, what we are going to check first, vital signs, right? We are going to check the vital signs to know the health status of the patient. Okay, vital signs are also called cardinal signs or vital parameters. Okay, vital signs, there are group signs, right? There are vital signs are the called cardinal signs or vital parameter. There are some parameters that we are going to check to know the physiological function of the client. Okay, later we know what are the vital parameters. If any abnormality occurs in the body, vital signs change immediately. Okay, if in a healthy person, vital signs are normal. If unhealthy person, if he has any disease or any illness, what will happen? The vital parameters also changes immediately. So that meaning we must know the patient is in condition is not good. In health condition is not good. We have to assess the patient for any health variation. Okay, I have uploaded some of the vital monitors. Okay, this is now we are using. Before in the beginning we are using, olden days we are using, now also we are using. Okay, sphygmomanometer, that is a manual mercurial blood pressure monitor. That is a sphygmomanometer which gives accurate reading. Also we are checking manually by using the stethoscope. And also we have a mercury thermometer, right? See, this is mercury and digital thermometer. And I also added fundoscope, peanut stethoscope. Okay, why I added because in pregnant women we are going to check also fetal heart rate also, right? This also one parameter to know the well-being of the fetus. So we are using fetoscope. Now we have a digital cardiac monitor, digital monitor, vital signs monitor. See, it's here in everything is there. You can see in one monitor everything, all the parameters are recorded. Okay, you can check. Here pulse rate is there, heart rate is there, BP is here, and saturation, respiration, and the temperature also there. Everything in one. Before we are checking blood pressure, pulse, we're counting respiration. Right now not like that. You you connect the monitor, and then you can come to know all the parameters, right? So it's very advanced. Now we are in very advanced. So, what are the vital signs or cardinal signs are? So, what are the vital parameters we are going to check to know the status of the client, health status of the client? There are 6 parameters One is body temperature, then pulse, respirations, blood pressure. They added fourth and fifth also, sorry, fifth and sixth also. It's oxygen saturation and the pain. Also, no pain also added as a cardinal signs, which is very important. In pain also shows the changes in the health condition. Okay, oxygen saturation also is a very important. So we have six parameters. In these six parameters, anyone can change. Patient is really in a his condition is changed. Okay, when respiration is very important. Airway is when we are checking, as we checking the respiration. If it is not normal, it's a patient is in critical conditions. Airway is the main what we are going to assess. Okay, so we must know all or six parameters also. It's very important. Okay. Now we are going to read about guidelines for measuring the vital signs. What are some of the few guidelines are there that you must know? Okay, so initial measurement of the vital signs provides baseline data on a client health status. Okay, initial measurement of vital signs provides baseline data on a client status. As patient come to the hospital, who is going to visit the patient? The nurse. We are the nurses. We are the receiving. We are going to approach the patient. So we are looking at the patient. Immediately we are going to check vital signs. This is the initial measurement which tells the baseline data on a client health status. Next one is some vital signs may be delegated to unlicensed assistive personnel, UAP, okay, but the nurse is responsible for the interpretation of the findings. Okay, some hospital, the nursing aides, they will have, they don't have a license, okay, to work as a registered nurse, but they learn how to check the vitals. They learned, okay, for them. You can delegate as a registered nurse. You can delegate them to check the vital sign, but who knows who is the responsible to interpret? Registered nurse. Registered nurse is the one who is responsible for the interpretation of the findings. You must always check with them. As they check the vitals, you also check with them. Check the data, okay? Check the record, how they documented. Is it normal, abnormal? You must check with them, okay? They are not skilled. So, still, some hospital, they are allocating or delegating to check vital signs, okay? And the nurse always document vital sign measurements and reports abnormal findings to the healthcare provider. No, we have temperature, we have vital signs chart, right? Every hospital has in different, okay? We all have vital signs chart, monitoring chart. So in that we have to document all the six parameters. We have to document for the pain. We have pain scale, right? Saturation also we have this. Everything is there in one chart, okay? So you have to document the vital signs as a patient condition changes. The frequency of checking the vital signs also changes, right? So we have to inform immediately to healthcare provider if there is any changes occurs during the hospital staying. Okay, so we must know why it's very important. Checking vitals is really sometimes it's a very critical cases. We forget. Sometimes we ignore, right? Vital signs on their own we ignore, but we should not like that. Okay, in with few seconds, few minutes, few hours, any time patient condition may change. So please check the vital signs. Okay, the basic step, the basic fundamental of nursing is checking the vital signs and document and inform immediately if there is any changes. Okay, and then now we are going to see when vital signs are measured. Okay, when the client is admitted to healthcare facility on initial contact with the client, as I said before, whenever patient got admitted. In not only with the sick, some patients also come in for the checkup. Some patient come with the sickness, no? Whoever come, you check the client, because nurses are the one who are going to contact with the client, okay? And during the physical assessment of a client, we also have a procedure, physical assessment. In the physical assessment, we are also checking vital signs. Before and after an invasive diagnostic procedure or surgical procedure. In any procedure, okay, in diagnostic procedure or invasive, okay, there is invasive and non-invasive. Example, invasive is a thoracosynthesis, okay. um, Thoracentesis, whatever the procedure you are doing, invasive, and diagnostic procedures. Thoracentesis is a diagnostic procedure, and surgical procedure, any OT, any patient for surgery, okay, for any type of surgery, you must check, okay, vital signs is very important. If there is any variation before OT, before taking to the OT client, you must inform the healthcare provider, okay. If the patient may have fever, patient may have high blood pressure, now that you should inform the healthcare provider. And prior to the administrations of medications, okay, prior to the administration of medications, okay, whenever there are some medications you are giving, now for that we have to check the vital signs before giving the medication, okay. We have to check the vital signs before giving some of the medication. Example, digoxin, tablets digoxin, what you're going to check before giving tablet digoxin. Okay, right. You're checking pulse. Okay, below 60 you should not give. Okay, it will decrease the pulse rate. Okay, when patient will have high pulse rate, antiarrhythmic drug. Okay, now they are giving this tablet to decrease the pulse rate. So below 60 you should not give. Some of the drugs you cannot give when blood pressure is low. Okay, when blood pressure is low, you cannot give antihypertensive drug. You must, before giving antihypertensive drug, you must check the blood pressure, right? Okay, these all the condition that you have to measure the blood pressure. Next is before, during and after blood transfusion. Okay, before, during and after blood transfusion. So it's very important before you taking the blood from the blood bank. Okay, before taking the blood from the blood bank, check vital signs. Don't check vital signs after you brought the blood from blood bank and keep waiting to check vital signs and the blood will get, okay, this all the problem you should avoid. Check vital signs, check temperature, check BP, okay, before getting the blood from the blood bank. Remember that so many times our nurses did this, okay. They will bring the blood from the blood bank without checking vital signs. What will happen? They keep waiting, the blood is there on the table, and this patient have fever, again taking the blood to the blood bank. It's really, you should not transfuse blood within 30 minutes after you brought from the blood bank. You know that some of the policy procedures are there, you must know, but vital signs has to check before bring the blood from the blood bank, okay. And also after blood transfusion you must check. During the blood transfusion, after the blood transfusion, check. Sometimes the blood will go very fast, patient will have fluid overload, patient will have a hypertension, this all the problems. So that's why we close observing first 15 minutes. We are close checking the vital signs, right? This is very important. Next is whenever known infection is present, whenever the infection is present, we are checking the vital signs. Okay, whenever the client's condition changes. Now, patients in the unit and patient is about to discharge, okay, and you think, oh, patient is going to discharge, no need to check vital signs. You may be okay, you just thinking the patient is going to discharge. Suddenly what will happen? Patient will get high blood pressure, may get high fever, so you can't discharge